as Dr. Ajit Babu said, I am in an institutional private practice, and actually Dr. Mangat,
No, you don't compare them. They are academic institutions.
Getting compared to their academics, but let us see.
Your speech will be stimulus for individual practitioners.
So let's see. This academia means sacred. This is actually all of us become either an academic or a teacher or enter private practice or quit both actually ophthalmology and go into hospital management, business management, like that. Only these few options are there. So what are the pros and cons in both? See, private practice versus academics. It is mainly academics, mainly a teacher or a learner, and other one is just a practicing ophthalmologist. One is mainly research, other one is hospital management. All of us have to make a choice, one of this, or have both in a balance. So advantage of academics, I'll tell you. One is it is an intellectual stimulus and growth by continuing education and interactions with experts. So you learn from others and you teach others. So ultimately your knowledge increases. The academic posts usually have better stability, and there is no financial capital needed like to start a private practice. And technology usually starts in the academic institutions first, not in ophthalmology always, but mostly technology starts in the academic institutions, and you have better reputation and practice. Well, reputation is more for academics. So this is advantage. Then what about private practice? Greater freedom. I am my own boss. I can do whatever I want. Then better equipped to change or adapt. Some new machine comes. If I can buy, I will buy and learn and do. Unlike an academic institution where it is there was so much hassles for developing a new technology. So greater opportunity for increased salary. That is the bottom line in private practice. So academics see interesting and different cases. He can do a lot of research, stay up on knowledge, top of line equipments, growth, but a growth is limited in academics. Maximum can be a professor. And the constant pressure is there to secure funding for research. That is also there. You have to keep on doing research. And another advantage of academics is you can take leave when you need. And your colleagues will look after your patients. But if you are an individual private practitioner, you can't do that. So you don't have to worry about day-to-day running of practice. In private practice, it is good for ambitious people who prizes his or her creativity and who can adapt and change easily. But there is always a financial reward. But there is a great responsibilities like marketing. Can you combine both? Now, this 2-3 things that I told is basically in a country like US or somewhere where academics is different and people teaching institute is different and private practice is a entirely different group. Indian scenario, most of the private institutions can or have academic mission. You can teach, perform research and publish in private practice. So we can actually have best of both worlds. How? You can actually, if you may be knowing that Charles Kellman developed phacoemulsification and Palikaris developed LASIK when they were in private practice. They were not in academic when they developed this. And so if there is something called the mental hybrid model, approach every clinical encounter with research and teaching in mind. I still remember JB sir, when he see one case, the thing that he will think is whether this can be published. So that attitude, nowadays we lose, we are not somehow see the patient, manage and send the patient off to see other patients. So this is that still I remember sir.
Probably in this juncture only I need to tell that an academician or academic blend always seeks complete knowledge within them, and they reports have changed the whole scenario of the pathology and ophthalmic diagnosis, everything, even so management also.
Mental hybrid model is possible if you have effective time management. And in American Academy website, they have given one example of Mr. Ming Wan. He was MD Harvard, PhD laser physics, postdoctoral fellowship in MIT, residency Wilshire Hospital, cornea fellowship from Bascom Palmer, and built Vanderbilt Laser Center. Then this is the maximum academics we can all achieve probably. Then he went to private practice. Now he is the director of eye hospital group, but he is still in research and publications. So this is one example of how you can get along with both these, best of both worlds. Enter private practice, part-time affiliation with university is possible. Many you can join some courses or a PhD or a part of affiliation with some university and teach if possible. Focus on clinical trials and research. In India, it is little difficult to get these trials, research, grants and all, but you can try at least. You can create your own new brand of hybrid career and enjoy the best of both worlds. Choose a path that fits to your beliefs, philosophy and personality and lifestyle. That is very important. In private practice, like this was I was just telling, join PhD or part-time research, teaching. You can teach DNB students or give speeches in local societies, national or international meetings, participate in scientific meetings, clinical research, fellowship training, and specialize in some area. You should have some specialization in some area. Then only you will get references and improve your credentials, and you will be known among your colleagues. And conduct basic and clinical research if possible, and apply for grants, especially ICMR and other grants are available. Collaborate with other fields of medicine. This is another thing that you can do. You can collaborate with neonatologists for ROP screening. You can collaborate with diabetologists for diabetic retinopathy screening, like that, depending on your field of interest, and collaborate with other fields of medicine. All this will improve your academic. So young ophthalmologists should understand that private practice without academics can throw you to isolation and deprive you of medical knowledge and surgical and non-surgical developments in your profession. And they should have, young ophthalmologists should have one foot in academia and one foot in private practice. So where am I? As Sir said, I am in an institute-based private practice. There are all latest instrumentations are available, interactions are there with good subspecialists, teaching is there, DNB institute students and fellows, presentations are there, local, state and national levels, publications, few publications every year, probably one or two, that's all. And read regularly to update your latest development. You can have journal clubs in the hospital, discuss with your colleagues, then only you will improve your. All this comes in academics. So probably by selecting suitable paths, each of us can pursue best of both academia and private practice. Thank you very much.